Today, Trent and I are going to be telling you how to set up the Pruitt 3 inline carotid shunt and the Pruitt 3 outline carotid shunt. When we receive the units out of the sterile package, 2 3/3C syringes will be in the box. We need to add a 1cc syringe, and we'll explain that in a few seconds. Just to pay heed right now, the inlying carotid shunt you will see is sort of one vertical line. That lies within the patient's carotid cavity, like our Argyle shunts that we use. The outlying is sitting outside, so the surgeon has more visualization within the field. It's a surgeon's preference whether they use the outlying or the inlying. So for setting up, you will need to have your syringes filled with hep saline. You will have to fill them with your hep saline off the back table. For the blue common carotid stopcock there, that is 1.5 mils of the solution we filled in the syringe. The red T-port that flushes, this would be the T-port. We need that filled with 2 mils. And the TB syringe, which is the one that for the white stopcock, which is the internal carotid, that needs 0.25 mils of hep saline, and that is testing the balloon. Trent now will show you where that balloon sits. We're going to pull the overflow balloon sheath down, and you're going to see that lighter yellow piece there. That is the overflow safety balloon. Trent now is going to flush the balloon. So he is going to turn that stopcock in the on position, and as you can see, the balloon is going to inflate. And it is fine with the 1.5. He's going to withdraw, making sure that comes back. All air should be out of the syringes as a notation. We turn it off in the off position, as you saw him do, and we leave the overflow balloon sheath away from the overflow balloon. Moving to the T-port now. This is going to flush these guys right here. So he will turn that in the on position there. He is now going to put his finger on one side, therefore flushing the internal balloon. And he's going to do that. And now this would be the common carotid balloon, the blue one here, and he's going to flush that one. He will now turn that in the off position. Now he'll move to the common carotid balloon test. He's going to turn that in the on position. And as you can see, the balloon is going to inflate. And that's just making sure that it goes up, there's no leaks, and that it's not defective. He's going to turn all stopcocks, again, must remain in the off position. When the surgeon asks for this, we will, in fact, hand up, could be a mosquito, could be a Kelly, and I'm going to go really zooming in on here. That is going to clamp on that white port, as you can see right there. Now on the outlying Pruitt carotid shunt, we're going to move over to here, and I'm going to zoom in again. That is exactly where you hand the clamp up on that. Hopefully this is helpful, and this is how we set up for the flushing and setting up for the Pruitt 3 inlying and outlying carotid shunts. Thank you.